The healthcare system in America stands at a critical juncture, facing a convergence of forces that threaten to dramatically reduce access to affordable coverage for millions. By the end of 2025, enhanced subsidies that have kept premiums manageable will expire. What happens when temporary affordability measures expire in a system that is already under strain? In response, the House of Representatives has passed legislation to extend the enhanced subsidies, while the Senate continues to debate the scope and duration of any renewal. As these deliberations continue, the healthcare system enters 2026 with higher premiums, increased uncertainty, and unresolved questions about the federal government's long-term role in ensuring affordable coverage unless Congress intervenes. This, combined with rising medical costs, market instability, and legal challenges to preventive care, creates a perfect storm that could leave 3 to 4 million Americans without any health coverage. The situation is urgent and imminent. We're standing at the edge of a financial cliff that could reverse decades of progress in healthcare access, turning it into a privilege only the wealthy can afford. This is not a theoretical crisis, but a real and immediate threat to the well-being of families across the country. This subsidy collapse will lead to a dramatic increase in premiums for millions of Americans, potentially doubling or tripling their monthly costs. Without these subsidies, coverage could become unaffordable for many working families across the country. This is an immediate and significant threat, as the loss of financial help will be sudden rather than gradual. Consider this. For a family currently paying $360 per month, their premium could jump to $850 or more per month starting in January 2026. This sudden and drastic increase in costs threatens to price many people out of the healthcare system entirely. Even without the subsidy cliff, healthcare costs continue to rise rapidly each year, driven by factors like increasing hospital and pharmaceutical prices, pent-up demand, and administrative complexity. This baseline inflation compounds the challenge posed by the subsidy cliff. Families face both the loss of financial assistance and rising underlying costs. The structure of the healthcare system, which incentivizes treatment over prevention and volume over value, ensures that cost pressures will persist regardless of subsidy policy. This creates a vicious cycle where rising prices lead to higher premiums, pushing healthier people out of the market and further exacerbating the cost spiral. We need to address the fundamental drivers of healthcare inflation to truly tackle the affordability crisis facing American families. Now consider the dangerous market dynamic that could unfold, what experts call a death spiral. Here's how it works. Rising premiums push healthy people to drop coverage, leaving only the sickest individuals insured. This leads to further premium increases as insurers try to cover the more expensive remaining pool. Eventually, the market becomes unstable, with insurers exiting and leaving fewer affordable options. This dynamic represents a worst-case scenario that the 2026 subsidy cliff could potentially trigger. It's crucial to understand this cycle and take steps to prevent it from unfolding. Simultaneously, we face another critical threat: the ACA's requirement that insurers cover preventive services without cost sharing is under legal threat. Screenings, immunizations, and wellness visits that are currently free could suddenly require co-pays or deductibles. Cancer screenings like mammograms and colonoscopies that have saved lives through early detection could become cost prohibitive, leading to delayed diagnoses and worse outcomes. Routine immunizations for children and adults may no longer be free, creating barriers to public health protection and disease prevention. If these protections are struck down, People may skip preventive care due to cost, only seeking treatment when conditions become severe and expensive. Consider this. Even a $200 copay for a colonoscopy can be enough for families to delay or skip the screening, potentially allowing preventable cancers to develop. These four key forces are converging to create a perfect storm: subsidy collapse, cost inflation, risk pool spiral, and coverage erosion. These forces don't operate in isolation. They converge and amplify each other, creating a crisis far greater than the sum of its parts. For a family facing doubled premiums from subsidy loss, that would be difficult enough. But when combined with baseline cost inflation, market instability, and new costs for preventive care, the cumulative burden becomes insurmountable. The convergence of these factors creates a cascading failure scenario, with each factor feeding the others in a reinforcing cycle that accelerates toward market collapse. Families standing at the cliff edge face not one threat, but four simultaneous avalanches, each pushing them closer to the precipice of lost coverage and financial ruin. Let's humanize these statistics. Millions of Americans could lose their health insurance entirely when subsidies expire and premiums become unaffordable. The average post-subsidy cost for families could jump from $360 to $850 per month, a crushing increase for working households. Costs could double or triple overnight for millions when enhanced financial assistance disappears. Behind these statistics are real families facing impossible choices. Do they drop coverage and hope no one gets seriously ill? Do they cut back on essentials like food and transportation? This scenario will be multiplied millions of times across the country, impacting small business owners, early retirees, freelancers, and middle-income families who earn too much for Medicaid, but not enough to absorb massive premium hikes. The Affordable Care Act has made significant progress in reducing the uninsured rate and expanding access to healthcare coverage. This progress is now at risk due to the 2026 coverage cliff, which could reverse these gains and return the U.S. to an era of high uninsurance and medical bankruptcy. The United States already lags behind other developed nations in guaranteeing universal healthcare access. Allowing coverage to erode would be an international embarrassment and a moral failure. This issue goes beyond just a technical policy problem. It's a fundamental question about American values and priorities around healthcare as a right or a privilege. The coverage cliff doesn't just harm those who lose insurance, but creates ripple effects throughout the economy and society in terms of worker productivity, entrepreneurship, and economic mobility. The choice facing policymakers in 2026 is critical. It's a pivotal moment that will determine the trajectory of healthcare access and affordability in the United States. If Congress fails to extend enhanced subsidies, millions will lose coverage, markets will destabilize, and families will face impossible choices between healthcare and other necessities. This would reverse a decade of progress. Conversely, congressional action to extend or make permanent enhanced subsidies, coupled with cost control measures and preventive care protections, could stabilize markets and ensure continued coverage access for millions. The modeling is clear, the mechanisms are understood, and the human impact is predictable. This isn't a hypothetical scenario. It's a scheduled crisis that will detonate in January 2026 unless Congress acts. Time is running short. Insurance companies, families, and markets all need certainty and stability. The window for action is closing, and the consequences of inaction will be severe. In summary, America is facing a critical situation with four converging forces that threaten to push 3 to 4 million people into lost coverage and financial ruin. The key forces are subsidy expiration, cost inflation, market instability, and coverage erosion. This coverage cliff will hit in December 2025, when families currently paying $360 per month could see bills spike to $850 or higher. This would reverse a decade of coverage gains, with devastating consequences for millions. But this outcome is not inevitable. Congress can act to extend enhanced subsidies and implement cost control measures. There are tools available to prevent this crisis, but political will is needed to deploy them before time runs out. We all need to demand congressional action, spread awareness, and plan ahead for potential premium increases. The clock is ticking, and the time to act is now, to avoid millions falling into the chasm of lost coverage and financial devastation.